We like to call it the Supernatural Hour. And now, our hosts.
Hey, welcome to the Supernatural Hour. I'm Raven.
I'm Rogue.
I'm Chad.
And this is Doc. We ready to get to our main topic today? All right, we'll get on to the main topic. So the topic we've chosen to speak about today is sleep paralysis. How familiar are you guys with sleep paralysis?
So, I have heard about it a bunch of times, and when people call us for residentials, probably, I don't know, roughly 30% of the time, someone always says something about sleep paralysis.
It seems to be pretty common with a lot of the residential investigations. I mean, not like all of the time, but like you said, maybe 30% or 20% of the time.
But the interesting thing is when I was researching it for this podcast, it was really hard to find much paranormal. It's mostly medical.
Right, well, sleep paralysis in and of itself is a medical condition, but a lot of people will either confuse it with a paranormal event or misinterpret it. The basis, what people consider sleep paralysis, is you have a period of time where you have consciousness, but you're not able to move. And these happen either right before falling fully asleep or while trying to wake up. And they can be terrifying. You'll hear these stories. A lot of times people will associate these events with having some entity present in the room. Something dark.
So it's something that they perceive at the same time, or
right. So you'll hear this a lot with alien abduction stories, for example. People will say, "Oh, I was in my room and I couldn't move, and I could tell there were beings standing in the room watching over me, either leaning over, in the corner of the room, and I couldn't get a good view of them." And that's a very common finding in cases of sleep paralysis, that there's something present in the room, and it incites a lot of fear. It doesn't always have to be aliens, but I think, call me a skeptic.
it could be Slender Man.
Could be Slender Man. Call me a skeptic. But I would say, when people have these abduction stories where they're paralyzed, or other times they'll have a story about a demon or a devil that's sitting on their chest and making it so they can't breathe well, kind of your stories of the succubus, incubus kind of stories. A lot of these have been attributed to sleep paralysis.
And how would we know the difference, Doc?
That's a good question.
That's the question that kept coming into my mind as I was reading into this, is how would we know the difference?
I guess the question is there a difference?
So here's my little thought process. As I was researching and I'm reading medical, I thought, I don't doubt that it's medical at all.
Mm-hmm.
I have zero doubt that there is a medical explanation for, I would even say, most sleep paralysis cases. That being said, I personally believe that a small percentage of sleep paralysis cases could be strictly paranormal.
It's possible.
I think that there's a happy medium. We could argue, and I kept trying to get Castle, if you're listening, I'm calling you out. Big sisters can do that. I kept trying to get him to do a podcast on, is it possession or is it mental illness?
Ooh.
But guess who gets to pick the podcast topics now? Me. So at some point we'll talk about that. It's kind of a chicken and egg thing,
Right.
And even when you do residentials, that's one of the questions that you sometimes ask is anybody on a medication that could be hallucinogenic? And so, I think there's a case for both.
Mm-hmm.
And I think there could be a case for both in sleep paralysis as well. So, I don't want listeners going, "Oh, no, I was really, abducted by aliens." Maybe
right.
You were. But I tend to lean towards, and I don't even want to throw out a percentage.
Right.
I do think that the biggest percentage is probably medical.
I think sleep paralysis is more common than people realize. What happens is, as your body's moving into deeper stages of sleep, you become more relaxed. And I was kind of joking here with Silent Dawn.
That could be in pretty silent.
AKA Chad. About how terrifying it would be if we could actually move during our dreams. I don't think...
And why is that?
Because we would kill ourselves. I mean,
Our partner.
if you were able to actively move and act out your dreams in their entirety while you were unconscious, you'd have no perception of reality, and you'd end up falling down the stairs and breaking your neck. And so your body naturally, as a way to try to protect you, relaxes your muscles to the point that you can't move them, and then allows, that's part of the NREM sleep. The non-rapid eye movement sleep is this descent into rapid eye movement REM sleep, which is where the dream state occurs.
So what about when you're in the dream state, and then all of a sudden you do that, and you know what I'm talking about?
Yeah, you feel like you're falling off of something.
Well, yeah, but then you move. I mean, you
snap right out of it.
Snap right out of it, and you're like,
and for the most part, there's not a lot of lag time between this relaxation into REM, either going into or coming out of. The times where it becomes problematic is when we have these cases of sleep paralysis. And I would say most classically they happen when people are trying to wake up, but they can't happen while people are falling asleep. But there's a gap, basically, between where your dreaming is and where your full relaxation is, so you maintain a level of consciousness. And I think what ends up happening is you're trying to make sense of what's going on, and you're freaked out. And so obviously there's still some components of that dream state where you feel something ominous or dark or heavy that's in the room, because it's not a normal feeling to not be able to move, and sometimes feel like you're being choked, not be able to clear your secretions or swallow or any of these things.
See, that I've never had the sleep paralysis where I feel like I'm awake and, a demon or an alien standing over me. But I do have this thing that you just kind of mentioned, is maybe once or twice a month I will, just right before I wake up, in my, I don't even want to say a dream, but it's like something in my brain says, if you swallow, something really bad is going to happen. That's why fight swallowing.
It's the spider.
Fight, don't even say
Yeah,
that.
the spiders we all eat every year. It's one of those, just tickling the throat a little bit.
And so then I wake up, and when I wake up, I'm like panicked. I'm like, I swallowed. Am I gonna die? And don't make that dirty. I can see it. Don't even go there. Okay, but I wake up and I'm just in this panic of, I just have to throw it out there because I know where it can go. And so that would be my sleep paralysis. It's just this, in my dream, if I swallow, like acid's gonna drip down to my toes or something, I don't know. So
interesting. And there's probably a component of that transitioning from kind of dream to reality, where there's a sense of danger, right? You have that sense of danger. It may not be that you can't move your entire body, but it's like, don't clear your throat. Don't do it.
But see, for me, I never thought, oh my gosh, it was a demon. And I'm not calling out anybody that does, because I do believe that a negative entity could cause this as well. So do not send hate mail to me.
Right. From a medical perspective, a lot of people don't experience this, but there are factors that do play into whether you're more likely to have an episode of sleep paralysis. If you have poor sleep hygiene, meaning
we're having an episode of sleep paralysis right now.
We're making you sleepy.
No, it's an episode.
Oh, this whole we are hosting an episode on sleep paralysis. Dad joke. Thank you. That was a groaner. Oh.
None of us even got it.
Oh.
You need to stay silent.
The audience will get it.
So the factors that come into play are, lack of good sleep. If you don't have good quality sleep, sleep hygiene is important. Going to sleep around the same time. Insomnia. If you've been up for too long.
What about sleep medication?
They can actually kind of help break through this.
Oh, okay.
They can help you get to that level of sleep more quickly. In fact, they'll prescribe sleep medication or antidepressants sometimes if people have severe sleep paralysis, a lot of sleep paralysis episodes.
Now, see, I tend to have insomnia about once a month. You can read into that what you will, because you're probably right. And, for about 3 or 4 days. And I've noticed that even if I'm not sick, if I take NyQuil, boom, it just knocks me right out.
There you go. So yeah, they may be actually more protective, I guess, against getting sleep paralysis. They do mention that people who have things like narcolepsy or sleep apnea are also at higher risk just because they don't get good quality sleep, and so their body gets confused with this transition.
Interesting.
So my question, and I realize that there's probably 1,000 different factors. This is not medical advice to see your doctor. But let's just say someone came into the emergency room and complained of sleep paralysis. Let's just assume that there's nothing else wrong with them. In general, what are some things you might do?
Reassurance.
Can you code them like you code with the evil eye?
You can. Mal de ojo. I'm pretty sure sleep paralysis is in there. I've had a case of sleep paralysis come into the emergency department as well.
That was not an EVP. That was phone droppage.
That was my phone breaking.
Oh.
But it has happened. I've had a patient that's come in and said, "Oh my gosh, the weirdest thing happened. I woke up and I couldn't move and I was scared, but I couldn't tell anybody." And I had to say, "Oh yeah, that's sleep paralysis."
So you got the demons.
Yeah, it's either sleep paralysis or a demon sitting on your chest or an alien abduction. Take your pick. No, and for me, it was actually pretty easy to give them that reassurance because I have personally had an episode of sleep paralysis. It's weird. It is creepy.
So there's a little list that I ran across that said, check with your doctor if you have these concerns. Do you feel anxious about your symptoms? Because a lot of times, like you said, just the reassurance that everything's okay.
Yep.
If your symptoms leave you really tired during the day, because that could be a sleep problem. You might even have, what's the word I want? What is it when you need a CPAP?
Sleep apnea.
Yes, I think we already talked about that. Or if your symptoms keep you up during the night, because lack of sleep can be attributed to a lot of things,
Right.
I would assume.
And it will increase your risk of having episodes of sleep paralysis as well. Absolutely. So, overwhelmingly, these things, they happen, they resolve. Like I said, I've had it happen to me one time in my life. I can tell you a little bit about my
How old
story.
were you?
I was 17 or 18.
Okay.
And I was laying in my bed and I woke up and realized I couldn't move, and I could feel that my breathing was a little, I don't say restricted, but just hard to breathe. And that's because your sleep patterns, you don't breathe a whole lot. You breathe pretty slowly when you're sleeping, but when you're conscious,
Shallow
you feel like you need to breathe more, and so you're conscious and you're going, let's pull in more air, and you can't. And it does. It's a very scary feeling because you feel like you're suffocating. You can't get enough air. And then you lay there and you can't breathe more, you can't move. But I distinctly remember with my episode that I felt like there was something just standing right next to me, just outside of view. And I could feel this heaviness, right? And like a growling. It was almost like it was a werewolf or something. So some people get aliens, some people get demons sitting on their chest.
You got a werewolf.
Mine's a werewolf that's just sitting right off to the left side of my face, and I can't look at it, but I can hear it, and I know it's there. And so I sat there for a few minutes, and I got a little panicky, and you're sitting there in your mind going, move your head, move your arms, and nothing's moving. And it is a weird, weird sensation.
And you literally sat there for a few minutes. It wasn't a few seconds.
It was, it felt like forever. It was probably a couple of minutes. But I remember finally at some point when I was kind of yelling at myself to move, I was able to turn my head to the left just to see what was there. And I got this big, loud growling sound in my ear. And then suddenly, boom, I could move everything, woke up, sat up, breathing heavy, going, holy crap, what just happened to me? And, I could easily see how somebody could perceive that as a paranormal incident, that there was a dark entity or spirit in the room that was making them paralyzed, right?
Yeah.
I had one of those, what the hell just happened to me moments, and started doing some research, and I thought, okay, this was probably just an episode of sleep paralysis.
So you did mention that with sleep paralysis, it's your body's attempt to kind of keep you from hurting yourself.
Right.
But there's the inverse of sleep paralysis, and that's sleepwalking.
Right. This is where people are up and moving while they are asleep, or at least maybe not in the deepest parts of sleep, but still sleeping. They have no recollection of what they're doing.
Yeah, afterwards. And that's a whole kind of the inverse of the sleep paralysis, I would think, of, up wandering around, doing things
but not
without
really
any
there.
consciousness.
Mm-hmm.
And yet doing things relatively safely, like going up and down stairs. And
right, so they're not in the deepest stages of sleep. They're not in REM sleep necessarily, but they are in a deeper level of sleep, so they don't have awareness, but their body is perceptive to their environment.
It's kind of like when I'm driving sometimes and I get there and it's like, how did I get here?
Yeah, basically like hypnosis, and that's terrifying. Just so you know.
If you are on TikTok, I haven't followed her, but she pops up on my feed every once in a while. There's the lady that sleepwalks. Klaus is shaking his head. He knows what I'm talking about. It's this lady, she sleepwalks. And she does it so much that she's put cameras around her house to film herself. And she'll kind of go through and narrate it for you, by putting words. And, she does things like she'll hide behind. And the way she narrates it, being awake, you can tell that she kind of remembers what was going on. Because she'll say, right now I'm hiding in a forest. And she's, hiding behind a tree. And she does the funniest things. I need to follow her because she's kind of hilarious. I don't know her name.
Does she lock herself in her home so she doesn't get out?
She's married or has a partner of some sort because he's in there as well.
Make sure she doesn't do something.
Yeah, but it's funny.
Oh, I'll have to look for her name.
Probably, if you go to TikTok and just search for Sleepwalker, it'll probably come right up. A blonde lady.
And while you're out there at the TikTok, get our TikTok.
Hey, shameless plug.
Yep. Advanced Paranormal, right? Or is it Advanced Paranormal?
Advanced Paranormal.
One of the two.
Okay.
So one of the things that, if you think you're having sleep paralysis or you are having sleep paralysis, you'll want to take care of the medical problems if there are any medical problems. And so one of the things that I saw several times was keep a journal, like a dream journal, but keep a sleep paralysis journal. Because when you go to the doctor, it helps doctors to know everything. If you go in with a whole bunch of I don't knows, they're like, right?
Right. You can only assume, right, at that point.
So, not only maybe keep a little journal of when it happens, whatever you think is important. What did you eat the night before? When did you go to sleep? Just journal everything. And then know your medical history, if possible. And I realize that sometimes if you're adopted or whatever, that could be a little difficult. But if you know it, be prepared to answer that too. Because the more information doc has, the better they can diagnose and treat whatever the symptom might be.
Well, like I said, this isn't an uncommon thing, but it shouldn't be a frequently occurring thing, right? Like, we see people who have cases of this, but if this is something that's happening on a regular basis, we need to determine if there's an underlying cause. Do you have sleep apnea? Do you have narcolepsy? And those are things that we can actually test and quantify and, and effectively treat, which may fix the problem. It's easy to, like I said, I've had it happen one time. I didn't go seek out a doctor to say, hey, what happened? But if it was something that was happening to me every week, yeah, I'd probably go get looked at, make sure everything's okay.
Let's say you take care of the medical thing first, and it just does not seem to be helping. And you've gone to the doctor, you've journaled your sleep apnea, you've given the proper medical history to the best of your knowledge, and you're still having it. Then maybe you give us a call, and let's come see if it is something paranormal, because I won't rule that completely out.
I was going to say, if you feel like you've been probed, maybe give us a call.
What a place to take it.
I'm just saying. Or maybe if you've got scratches on your body, those are not normal things.
Or probably some bruising.
Yeah, that's not normal with sleep paralysis, just saying.
So I've got some stories of some nighttime visitors, and you can put it in the medical aspect, you can put it in the paranormal aspect. Pepsi. So, but here's some stories. And if you remember Romeo and Juliet, there's a little nighttime sleep paralysis visitor in Shakespeare. But we're not going to go there. So a witch. Witches are very common, and it happens worldwide. It's not just, a certain area. We get witch stories from the United States, Brazil, Newfoundland, Germany, Scandinavia, and...
Is this in conjunction, witch stories in conjunction with sleep paralysis?
Yeah.
Okay.
Just, when you're, Doc sees a werewolf, some people see witches. And these generally involve a witch. Sometimes they refer to them a hag or some woman of some sort who sits on the sleeper's chest that induces terrifying dreams and causes the inability to breathe or move. And during the European and American witch trials, in the 17th century, this is one of the things that when they were trying witches, they would accuse them of keeping people from sleeping and shape-shifting into a cat. So that's where we get some of the cat folklore. is from these witches that sit on people's chests and then they transfigure so that you can.
Yeah, it's a very classic story, is something sitting on the chest, because, and I think from a sleep paralysis standpoint, it's a matter of you can't breathe and your brain's trying to make sense of why, and you're still kind of in that dream phase, and so it's like, oh, there's something terrifying sitting on my chest, making it difficult for me to breathe.
I had that happen once, and it was the cat sitting
was
on
it?
my chest.
Did
No.
it turn into a witch?
Or
No.
was it?
It was just a cat.
It was the cat. It's like, Leo, get off now.
Our cat?
Our cat.
Trying to murder you.
It's not
Okay.
the cat.
So another very common one, oddly enough, is a ghost. Go figure. For about 2,000 years in a lot of Asian countries, sleep paralysis was attributed to ghosts laying on top of you. And in some legends, the ghosts are recently deceased locals or relatives. And in others, it's like some specific ghost that's maybe not necessarily related, it's just always there. So an example is in Thailand, it's believed that sleep paralysis is caused by a widow ghost known as Phai Am, who sleeps on the chest of these sleep paralysis victims. And to defend against her, there would be men that would put lipstick on before going to bed, because they thought if we wear lipstick, this female ghost isn't going to come mess with us.
Because you're a guy with lipstick on?
That's what it says. I did not make this up.
The ghost doesn't like the ladyboys, is what we're saying.
Oh.
No,
Okay.
because they'll come in and go, oh, this is a woman, we'll leave them alone.
Oh.
So if you go to Thailand and a man's wearing the lipstick, I mean, in these days and ages, who knows, but
They will probably proposition you.
probably trying to keep the sleep paralysis. Or they'll proposition you. Or they're going through a transition, just don't ask.
That's
It's none of
right.
your business.
That's right.
Right.
Mind your own.
So a demon. Anybody surprised by demons?
No, that's what I ran into.
So this is the most commonly occurring in Middle East or African countries, and it's attributed to, again, the demons crouching on the chest in order to suffocate them because they're evil and they're trying to kill you. And this dated back even to ancient Arabian mythology, and they believed that it was winged demons would pounce on the chest of the sleepers who had not been praying, because they pray 5 times a day. And so, hey, you only prayed 3 times today, gonna suffocate you in your sleep.
I'm going to trampoline your chest.
It's
Let's do it.
pretty hardcore. So, and this was only about 20 years ago. There was actually some mass hysteria along the coast of East Africa about a bat-winged humanoid. So I always just go right to Wizard of Oz. The winged
The flying monkeys?
Yeah, so a bat-winged humanoid, that's hard to say. And its name was Popobawa.
That's hard to say, too.
Not as hard as bat-winged humanoids,
It's
apparently.
not in East Africa.
I didn't stumble over Popobawa. And he assaults and crushes the chest of sleeping victims until they pass out. But this was only 20 years ago. And there's mass hysteria. Vampires are very common in sleep paralysis. We live really close to Camp Williams. So there's the helicopters again.
I can hear him this time.
We like to play this game of what kind of helicopters are they? When you go outside and stare. Okay, but back to vampires.
Are we sure they're not the NSA helicopters?
Oh, great.
Awesome.
Abduction.
They live right next door to each other.
I know. We live next door to the NSA, too.
So, back to vampires. So, vampires, of course, are undead individuals, right? Who not only will cause the sleep paralysis, but then they suck your blood.
Yeah.
This is most common, shockingly enough, in southeastern Europe, and was really, really big in the 18th century.
When vampires were really, really popular?
Yes.
Okay.
Yes. And they're not the sparkly vampires that we think of today, thanks to Twilight.
They're not Edward.
Nope.
They're the
These were always
blood-sucking fiends.
I know, no sparkly designer clothes. These were usually bloated and ruddy.
Oh,
Wait, what?
that's lovely.
Ruddy,
The vampires were bloated and ruddy?
bloated and ruddy.
That is not what I was picturing when I was
No.
thinking vampire.
So
That guy's
not even a Bram Stoker
Oh.
kind of.
Or even the Van Helsing girls?
No,
No,
Not them either.
They said bloated and ruddy.
Bloated.
I'm gonna pass on this vampire. Thanks.
Yeah.
And
No
so,
Tom Cruise.
Yeah, no Tom
Brad
Cruise. Nope. So it says that the Diaries of Bram Stoker, the creator, actually his ideas for Dracula stemmed from a sleep paralysis episode that he had.
Oh.
And his hallucination was a woman trying to kiss him on the neck. And so it's kind of Dracula.
Interesting.
Yep.
Okay.
And then, again, none of these are shocking. The alien. A lot of people who have alien experiences. And in the 1950s, there was just an explosion of alien abduction movies, alien movies, UFO movies, testimonies of people in North America, primarily, being abducted. And people were claiming that they were paralyzed, couldn't move, screaming with fear, not being able to do anything, kind of your standard sleep paralysis symptoms. And many abductees also described feeling themselves floating to the sky, and bright lights, and probing.
See?
Go on. Come
I
on.
Really?
told you so.
Oh, you got your probing action.
Just saying.
Right. So those are kind of the main five.
They all have that classic overlay of I am defenseless, I can't move.
Yeah.
There is something that may have malintent, and it's either attacking me or, at least creating fear.
And there seems like different levels. Like there's kind of the level where there's something just out of sight or something that you're not able to see or move, kind of like your experience with the werewolf.
Right.
But the others seem very involved, where there's something happening right to them, and they're seeing it as they're in the middle of doing it, and they're being abducted by aliens.
Yeah,
there's something that's going on visually within them.
Right. And where I think this is where this is a transition from kind of non-REM to REM sleep, I think some of that may be dependent on how close you are to actual REM, whether it's more dreamlike or whether it's more based in reality with some strange overlays. If you're on one end of that spectrum when the consciousness occurs, maybe you'll be more apt to have a vivid dream and a more realistic feeling dream, I guess. Even mine felt pretty real. But I could tell I was in my bedroom, and I could tell, everything looked the same. I could just feel that presence on the side, and I don't know if that was just my mind trying to explain why I wasn't able to move. But for me, it wasn't super descript. Like I said, I couldn't even see it until I basically turned my head and heard a big sound and woke up all the way. But maybe these people that are being lifted in the air or transported into spaceships or whatever, we're gonna get so much hate now. I'm telling everyone they all got sleep paralysis. It's gonna be great. Maybe they're just closer to REM sleep.
Like I said, I do believe a small percentage could be paranormal. So if you believe yours is paranormal, we're not calling you them. So I did run across some old remedies for sleep paralysis.
Ooh,
This will be interesting.
We've already heard the modern ones. You so excited?
Yeah,
Maybe you can use some.
The remedies I've got are a CPAP if you got sleep apnea, sleep hygiene, go to bed at the same time, take your medicines for narcolepsy, and get on an antidepressant if you're dealing with that.
No shock therapy?
Yeah, no electroshock therapy.
Oh.
But I'm excited to hear about these folk medicines.
Oh, you're gonna like this.
Oh, yeah.
So back in the day, they used to, and we've talked about incubus and succubus before, and I think a long time ago we did an episode where we at least touched on those, and that's something we will get into more in depth at some point because it's on my list of stuff to talk about. But there was, back in the old days, they would refer to these more as the incubus and succubus, and they said that the cures, and I'm using my air quotations.
We can see that.
Or they can't. Imagine my air quotes. So they said that some of these remedies were more frightening than the sleep paralysis themselves. So there was a Byzantine physician named Paulus Aegineta. I have no idea how that is pronounced. So if you're familiar with that language, sorry. And this is in the 7th century. And he had 7 books on the history of medicine in the 7th century. So, boy, he has no idea what's in store, does he? So in one of these books, he explains that the most common way to treat sleep paralysis, and this is in quotes, bleeding, drastic purgatives, and friction of the extremities.
All right. So I'm assuming this has to do with balancing those humors.
Probably. And he said that he would place the focus on the head as the source of the problem, suggesting that if the above treatment did not work, the cupping and scarification of the throat, a restricted diet, and shaving of the head would cure this issue.
Yeah, that makes sense.
Cure it for me because I wouldn't report it again.
Yeah, weird. After initial treatment, no one ever complains of sleep paralysis. They're cured. Either that or you're going to start having sleep paralysis episodes about this guy coming and slitting your throat. Jeez.
Your werewolf just changes to the doctor's face.
Oh my gosh. Yeah, weird that everyone was cured after this.
So we're going to fast forward to the 10th century. Okay, so we've got a lot of...
Got 300 years in there, right?
Yeah, 300 years of improvements. And it was a Persian polymath, and his name, again, I'm going to slaughter this, Akhwani Bukhari. And he was subscribed to the ancient theory of humorism, and he believed that nightmares were caused by vapors of phlegm ascending from the stomach to suffocate the brain during sleep. That's where he thought this came from. And so his theory was obviously different than the first fellow's, but his treatment was not a whole lot different. In 300 years, you'd think you'd come up with something a little different, but they just did bloodletting. It's like you can't sleep, or you can't wake up, let's just take all your blood out.
Right. I'm trying to figure out the phlegm thing. Like, I guess, someone had sleep apnea, you could assume, oh my gosh, they're snoring real bad, maybe there's phlegm back in there. I don't know.
Suffocated with pillow.
Almost made it sound like there's consciousness. The phlegm is trying to
Well, what are
suffocate
they
the
doing with the
brain.
blood? Like a dialysis? Like, are they filtering the blood out and then putting
I
it
doubt
back?
Oh, no.
It's the
They
10th
ain't going
century.
back in.
There's no
No,
filtering.
we're just draining it out and then just
That's what they did with
giving
George
you
Washington.
right before death. And
Yeah, don't they just like slit you open and
Put it
let
in a
you
pan,
bleed
baby.
over a bowl or something?
Yep.
Bro, your
That's it.
face is great.
And you'll
Yeah.
feel so much better when
Yeah.
you lose consciousness from blood loss.
I feel better already.
Enough blood loss, you'll just pass out and you'll get a good sleep.
And you'll go straight to sleep. No sleep paralysis, guys. Just unconsciousness because you have no blood flow to your brain.
Because you won't be waking up.
All right, so let's move to what they refer to as the Christian era. So imagine the Age of Enlightenment when the paranormal kind of is getting very, very popular. And so they, at this time, thought everything was demonic. Everything's demonic. It's not medical at all. And so they were treated with prayers and exorcisms.
Well, we're getting better.
And so that's how they treated it.
These weren't like bleeding prayers or
I was going to say, yeah.
just regular.
Just exorcisms.
Sacrifice.
Wow, okay.
And then there's a fellow named John Bond. And every time I look at this, I see James Bond. And I'm thinking James Bond didn't happen in 1753. What the heck? John Bond. Not James Bond.
James Bond's grandfather.
Probably
Yes.
a few greats in there. I don't know.
Right.
Grandpa.
So this one's the creepiest, in my opinion, to be very honest with you. So he still called it an incubus or the demons. He still kind of had that paranormal thought going on.
So an incubus is male and a succubus is female. Is that correct?
Correct.
Should we spend?
We all nodded. Yes.
Yes.
Yes, because all of you can hear us nod. What he would do is he would poke the afflicted person with a pin or shake them to a wakeful state, which is probably the scariest thing you could do to someone temporarily immobilized in a hallucinatory state, other than maybe bloodletting. But,
They're already terrified and can't move, so you go in there and just shake them apart.
let's just bring your nightmare to life. you're imagining vampires? Let's just poke you in the neck with a pin a few times.
Poke them with a pin.
Love
Let's
it.
finish out this whole
Oh.
dream sequence.
Still not moving yet, huh? Just keep going. It's gonna break. Give it time. Go.
Love it.
Yep, that was his story. So yeah,
Just it's a shake awake system. Just go, wake up.
just go at it. So I think I would much rather have a doctor say, have you tried going to bed every night at the same time?
Yeah, let's start with that. Wow.
Yeah. So I'm really glad I didn't live back then when it comes to medicine because they did creepy stuff.
We were making pretty good progress getting into the whole, say prayers kind of thing, and then we took a little back there. But
Yeah, that
Okay.
kind of thing.
Just gonna jab you with a pin.
and now it's like, meh.
Now,
No
didn't
big
you
deal.
say you had some story?
I do. I have some stories. You're going to make me get my magic glasses on.
I've got my magic.
I know,
Mine's
so I
sitting on
can
the end of my
see.
nose, so I've got
I-
that about 90
They
years
just
old.
look like regular reading glasses to me.
I've been trying to do that, like the whole librarian looking over. I'm not
Sexy.
really good
This
at
is my
that.
sexy librarian look. It's not my granny look.
There you go.
They used to call me Granny Cinnamon. I hated that.
Why did you even bring it back up?
Because I've got my nose on. I've got my glasses on. See, today would warrant it. Today would warrant being called Granny Cinnamon. They're not here.
We have Reddit user Junior756, and he says he needs some help to see if this is sleep paralysis, and this is kind of where we talked about before. Because he says, one night I was getting ready to go to bed, and I was closing my eyes and ready to sleep, and 1 minute later, I heard footsteps coming closer to me, and I felt like someone was on me, and felt like they were behind me, watching me sleep, but I was wide awake, but eyes closed, and I could move still, but I didn't want to because I was afraid, and my heart was racing, and beating fast, so I just opened my eyes and moved and turned my light on quick and didn't feel scared no more. But every time I wanted to close my eyes to go to sleep again, I felt afraid to sleep again because of the sleep paralysis. So that was kind of where we kind of talked about, like, he wasn't even asleep yet. He was just kind of thinking about it. So,
I've got your answer already.
okay, go for it.
This is not sleep paralysis by definition, because he could still move, right?
Right,
Okay.
Paralysis would imply you were paralyzed.
right.
What he's having is what's called a hypnagogic hallucination.
Okay,
So a hypnagogic hallucination is a hallucination you have just prior to falling asleep. And so,
So would that include, when you're just falling asleep, and then it feels like your bed just dropped about 10 feet?
yeah, that shaking awake thing, I'm not sure if that's considered a hallucination. It's a really odd sensation of falling. I guess that would be hallucination in a sense, because you have a perception that's not real, right?
Because I've had that happen probably a dozen times in my life.
So that's probably a type of hypnagogic. Hypnopompic is when you're waking, hallucination. I'm pretty sure I've got this correct. I'll check.
well,
But
I have the definition
Oh.
because there was some doc that
If he gets it
sent me
wrong,
out this
you
little
can-
list.
Send hate mail to Doc.
that's right.
Hypnagogic or let's see, visual.
Okay.
Hypnagogic or let's see, the occur of the transition from wakefulness to sleep
It's hypnagogic. Yep.
is hypnagogic.
So
and
this is
sleep
a-
to wakefulness is hypnopompic.
This is a hypnagogic hallucination that this person is having.
And so the other one that I ran across, while there were different things that we can confuse as sleep paralysis, was delirium.
Mm-hmm.
So delirium is an abrupt change in the brain that causes mental confusion and emotional disruption. It makes it difficult to think, remember, sleep, pay attention, and more. You might experience delirium during alcohol withdrawal or after surgery or with dementia. So when I read that one hit home for me because I just a few weeks ago had a colonoscopy. And when I went in for my colonoscopy, when they were getting ready to knock me out, the nurse goes, "Oh, a lot of people really enjoy this. And this is like a medication vacation. And you're going to get a really good rest and really enjoy it. Like, good for you." And I'm, okay, that sounds great. So I'm getting ready to go to sleep, and the anesthesiologist is there, and his name is Ben. And I'm like, "Thanks, Ben. I can't wait for this vacation." Well, when I woke up crying harder than I've ever cried, like my dad had just died, type of a thing. And they could not console me for hours. I made them reach underneath my bed and grab my phone so I could FaceTime my son because I didn't trust them. I didn't know who they were. I didn't know what I was doing there. And I certainly didn't just go on a medication vacation.
Well, it sounds like a terrible vacation.
It was a terrible vacation, and I kept asking my nurse, "Well, what did you do to me that I'm remembering this that you don't want me to remember?" So when I grabbed my phone and I FaceTimed my son, they're like, "Oh, we're FaceTiming," and I'm like, "Oh yeah, because he needs to see what's going on around here." Like,
This is crazy.
it is. This is crazy, and I don't know if I should be trusting you. So when I read that, I was like, I get it, and I wish somebody would have actually explained that to me, because when I was asking the nurse what happened, he had no freaking idea.
Yeah, so delirium's an interesting thing. Delirium is always based in some type of medical or physiologic event, right? Whether that's infection or whether that's medication or whether it's something that has a medical root to it. In fact, this happens a lot in the emergency department. When I work, I'll have patients that come in that have psychosis, for example. And one of my jobs as a medical physician, as a medical doctor, is to rule out delirium as a cause. Because if they have delirium, a psychologist isn't going to be able to help that, right? If this person is acting crazy because they have a terrible infection, or they have a, encephalitis, an infection that's affecting their brain or something like that, I have to be certain that their condition is rooted in psychosis. It's rooted in a psychogenic or behavioral health component as opposed to a medically derived problem.
Right.
And medications, same thing. They can make people act funny. I use a medicine called ketamine quite a bit for sedations when we're setting bones in people who have fractures. And it's an interesting thing. Kids do really well with it. Usually they'll have this medicine is an amnestic. It causes amnesia. It's also hallucinogenic. People use it on the street under the name Special K. I had an old grandma say, "Don't give me Special K," and I laughed so hard in the emergency department. And I thought, how did she know this stuff was called Special K? She said, "Don't give me that Special K." But what it does is it creates amnesia. It's a pain medicine, but it also creates hallucinations. And it's dose dependent. Depending on how much you're given can actually affect the type of hallucinations that you have. In kids, like I said, most of the time they have very pleasant hallucinations. It's like rainbows and unicorns and cotton candy, and they're usually like, when they're coming out of it, they're smiling and laughing and blowing kisses. I've had a couple of patients, I've had to use it on adults, which I don't love to do, but sometimes it's the best medicine. I had a guy come out screaming that he was in a trapezoid.
Oh.
And I'm not quite sure how you end up in a two-dimensional object, but he was, and he just sat there screaming, "I'm in a trapezoid, I'm in a trapezoid." And he did not love the effect of the medication, obviously, because he remembered coming out of it. I've had people tell, alien abduction stories while they were on ketamine was another thing that I've seen people express. But this is all drug delirium is what this is, or drug psychosis if you take long-term stuff like amphetamines. We get people that will sometimes come in that are not in touch with reality, and they're experiencing drug psychosis, which is also, a big differentiator for us. Is a psychiatrist isn't going to help somebody who's having psychosis related to drug use. The answer to that is stop using drugs, right? But your experience sounds a lot like you had a bad trip, I guess I would say.
That's exactly what the nurse told me, verbatim. You just had a bad
Yeah,
trip.
you got into some Special K or something, and you had a bad trip.
That's hilarious. You use those words as that's what he... And I was like, well, I need to understand then. What was this bad trip?
I'm an ER doc. I use all sorts of words.
That's hilarious.
Especially medical terms like wonky. I'll use wonky sometimes. But
That was on page
Love
what
it.
of
That's
the...
right. When I started my residency, we learned to say wonky.
I use that word sometimes.
Yeah.
Or goopy. Or gunk. Yeah, I say all sorts of things. People are like, "What? This guy's a doctor?" Sure I am.
And there's a code for that.
There's the certificate on the wall.
I'll go ahead and diagnose you with goopy eye, and we'll call it a day.
Love it.
All right. And last but not least, get your Supernatural Hour swag at advancedparanormal.com. We have a lot of different items available. We've got mugs and shirts and stickers,
Tapestry.
and always the tapestry.
Stay spooky, my haunted friends.
I love you, Nicholas.
Hey, good night.
Good night.
You've been listening to the Supernatural Hour at AdvancedParanormal.com. The Supernatural Hour is part of the Radio Ronin network found at RadioRonin.com. Copyright by Advanced Paranormal Services.